right, everyone, and welcome back. Today we are talking about diverticulitis. Diverticulitis is one of those things that can be really scary when it happens. It's often sudden, pretty intense pain. You end up going to the urgent care or the emergency room. You're given antibiotics, and then you're told to follow some version of a soft or low fiber diet. But then you're sent home without a whole lot of clarity on what happens next. And that's usually where all the questions pop up. How long am I supposed to eat like this? When do I start adding foods back in? And most importantly, how do I prevent this from happening again? So, in today's episode, I want to walk you through the full picture. What's actually happening during a diverticulitis flare? What to do during that acute phase, and then how to transition your diet in a way that supports healing without getting stuck in that low fiber phase longer than you need to. And we're also going to touch on what to do longer term, especially if this is something that's happened more than once to you. And if you're looking for a deeper dive into the longer term side of things, I do have a full episode on diverticulosis. And with that, I have an accompanying diet guide that walks through what your maintenance plan should actually look like once you're out of the flare phase. Make sure and check out that episode and the accompanying guide, which we will link to in the show notes. But today we're going to talk about the acute phase of diverticulitis, what it actually is, and what's going on in your body when a flare happens. First of all, let's define diverticulitis. What is that? Because there's certainly a lot of confusion between the two terms, diverticulosis and diverticulitis. So, diverticulosis is when you have those small pouches that have formed in the wall of the colon. And the diverticulosis just refers to when you have the pouches. So, the approach to managing that is preventing diverticulitis, which means preventing pressure forcing stool or basically microbes into those pouches. So diverticulitis actually is when those pouches have become inflamed or infected. And those pouches are called diverticula. So when someone simply has the presence of these pouches, it's called diverticulosis. And actually, diverticulosis is very common, especially as we get older, and many people have it without ever realizing it. It tends to be something they find when they do a colonoscopy. And diverticulitis is when one or more of those pouches becomes inflamed. And when that happens, symptoms can come on fairly suddenly, and they tend to include abdominal pain. It's often on the lower left side, fever, nausea, bloating, and changes in bowel habits like either constipation or diarrhea. Nutrition becomes particularly important during this time because the digestive system is actively irritated and needs a chance to calm down. So, the dietary approach during diverticulitis is very different from the long-term nutrition strategy used for diverticulosis, which focuses more on fiber and keeping your colon healthy overall. So, what are the diet changes then for diverticulitis? So, when you do have that active flare marked by that inflamed, irritated lining of the colon, that's when we really want to use the diet to help reduce symptoms and support healing during this phase. So, during this time, the digestive tract is much more sensitive than usual, and foods that are normally helpful, like high fiber foods, can temporarily worsen that discomfort. And just to be clear, the treatment for diverticulitis is not diet. The treatment is going to be medical treatment, antibiotics, but diet is the supportive piece of it. When it comes to diverticulitis, we're looking at a low fiber diet. Fiber normally plays an important role in digestive health by increasing stool bulk and better regularity, more normal bowel movements. But during a flare, when the colon is inflamed and irritated, we do want to cut back on the dietary fiber overall just during that period where the symptoms are active. And that's because I often explain it like when your intestines are inflamed or irritated for any reason, it's like having maybe a rug burn. So you have some kind of irritated raw tissue. And fiber is like putting sandpaper over that rug burn. So it just makes things more irritated and it can actually increase pain, cramping, even bloating. It can place extra pressure on the irritated area and it also can not really allow it to heal. So for that reason, doctors typically recommend a temporary step down approach to eating while the inflammation settles. And then instead of jumping from that back into a normal diet, food is usually introduced in stages so that the digestive system can gradually return to normal function. So, what does that look like in real life? The typical progression looks like number one, you may be on clear liquids just briefly. So, maybe for 24 to 48 hours. You could be on clear liquids just depending on symptoms. And that's the phase where most people may just stay in that short term. We're focusing on clear broths and juices and things like that. The next phase is the low fiber phase, and then eventually you'll gradually reintroduce fiber. So we are going to go deeper into those stages and what each one entails, but let's pause here for a second because the next part is where I see most people get stuck. So let me tell you about the most common mistake I see after a flare, because I see this happening as soon as the acute symptoms improve. So what happens is you're told to follow a low fiber diet during recovery, and that is the appropriate thing to do. But because diverticulitis can be such a painful and scary experience, many people become understandably nervous about reintroducing fibers. And there's often a misunderstanding that high fiber foods somehow caused the flare in the first place, when in reality, diverticulitis is related to inflammation in the colon. It's not because of any single food. So as a result, people end up staying on a very low fiber diet for months or avoiding specific foods for months, sometimes even years, because they either misunderstood the information they were given or they're just so afraid that certain foods are going to trigger another flare. And the problem with that is this can actually work against your long-term colon health. And this is where fiber really starts to matter long-term, because when overall fiber intake is low, constipation can develop more easily. And that is one of the factors associated with diverticular issues. So over time, that added pressure of the constipation can place more strain on the very areas of the colon that were already vulnerable. So, in other words, that low fiber diet that's helpful during the active flare can end up working against you when you're looking at preventing a future flare and just overall maintenance of colon health. So fiber does then become an important part of helping reduce that pressure in the colon and supporting healthy bowel movement. So it really is a catch-22 where this is truly an area where the dietary approach for the flare is almost the complete opposite of the dietary approach to prevent a flare, which makes it incredibly confusing, especially when the two words diverticulosis and diverticulitis are so similar that a lot of people are Googling them, not even realizing they have them flipped around, and you could potentially get the wrong diet that way. So that's part of the reason we're talking about this, so we can really be clear on what to do in each phase. And basically what we're saying here is that the goal of the diverticulitis diet is not to eliminate fiber permanently. The low fiber phase is simply a temporary step that allows inflammation to calm down. And once symptoms improve, the focus gradually shifts toward rebuilding fiber in a gentle, strategic way so the system can return to a healthier long-term pattern. So let's break down these stages of the diet a little bit more clearly. Stage one is the clear liquid diet. This is during the really acute symptoms, the first day or two. So when you have that pain, tenderness, or other symptoms that are at that point where they're at their worst, doctors will often recommend starting with that clear liquid diet and then advancing it as symptoms improve. So this focuses on just calming down that colon irritation. And we just keep your intake really simple during this part because clear liquids move through your gut easily and they don't create that same mechanical stimulation that solid foods do. just to help you get back on your feet and get a little bit more comfortable while your body begins to recover. And the foods that we're looking at, it's a pretty short list. You're going to be on broth or clear soups, water, electrolyte beverages, maybe some gentle herbal teas, maybe jello or gelatin, and clear juices without pulp, like maybe apple juice or grape juice. So this stage is very short term. Many people will follow it just for a couple of days. And as symptoms begin to improve, most people can move fairly quickly into the next stage where gentle low fiber foods are gradually introduced. So stage 2 is your low fiber phase. And this is during the early recovery phase. So once symptoms start to improve after a day or two, you want to transition from clear liquids to a soft diet made up of gentle low fiber foods. And this stage is where the digestive system starts easing back into more normal eating, but the goal is still to keep things simple while the colon continues to heal. So you're eating solid foods, you're eating a balanced diet, but it's low in fiber. And that way it's generally easier to digest and gentler on the system while inflammation continues to settle. So that way we're placing less strain on the colon. And some common foods that we incorporate during this phase are things like white rice, white toast, any kind of refined bread or cracker, like white crackers, plain pasta. As far as proteins, eggs are great, yogurt, chicken or fish, mashed potatoes, bananas, applesauce, those foods. So these foods provide you nourishment and energy while being really gentle on your gut. And it's usually best to avoid higher fiber foods during this phase. That would be things like raw vegetables and salads, beans and legumes, whole grains, nuts and seeds until symptoms have clearly improved for you. One a client that I worked with, Carol, she came to us just a few months after her first flare. She had done exactly what she had told. She had done liquids for a couple days, then she was on low fiber foods, but no one had explained to her when or how to start adding fiber back in. So by the time I spoke to her, she had been living on white toast, eggs, yogurt, and mashed potatoes for nearly 3 months because she was afraid to eat anything else. She wasn't sure if, those foods were going to trigger a flare again, and she was just nervous about it. So what we walked through together was I shared with her the information I'm sharing with you, that the low fiber diet is to help the inflammation settle. It's not supposed to be a long-term way of eating when you have diverticulosis. So we helped her build a gradual plan to start reintroducing fiber little by little. So we started with softer foods like oatmeal and cooked vegetables. And then we just built from there. And her digestion became more regular and more comfortable because she was actually getting constipated from, oh my goodness, from that low fiber diet, which is actually the opposite of what was good for her and what would have prevented what was going to prevent another attack. So what I want for you guys is, instead of feeling afraid of food, I want you to finally understand what these stages are of recovery and how to move forward safely. So that brings us into the third phase, which is gradually reintroducing fiber. And you do this once symptoms have clearly improved, you don't feel as inflamed. Those acute symptoms that had popped up initially have had time to settle. And so we might be looking at a few weeks here. It really just depends on the situation, but once you feel those symptoms really starting to settle, that's when we want to gradually build back in the fiber intake so that the gut can return to a more balanced diet and a more balanced ecosystem. So that's how we support regular bowel movements and ultimately reduce strain on the areas of the colon where those diverticula have formed. And the key during this stage is to rebuild fiber slowly rather than jumping straight back into a high fiber diet all at once. A simple approach is to introduce one new higher fiber food at a time and give your digestive system a day or two to see how it responds before adding anything new. Many people might start by adding small portions. So I would start with, typically, we start with gentler fiber foods and just small portions. So that's things like oatmeal, chia seeds, berries, apples with skin, and small portions of things like whole grains, like brown rice or whole grain toast. Once you see that you're doing well with those foods, then we can start adding in the heavier hitters, things like beans and lentils, nuts and seeds, larger portions of raw vegetables, and more whole grains like quinoa. And then if these foods are tolerated well, meaning you're having no significant pain or bloating or digestive upset, then you can gradually increase your portion sizes or add another fiber containing food every couple of days. And at any point, if something doesn't feel quite right, it usually helps to just pause, return to the foods that were previously well tolerated, maybe go back on the low fiber for a couple days, and then let yourself stabilize and try again a few days or a week later. Over time, most people are able to build back a normal, balanced, high fiber eating pattern that supports regular bowel movements and longer term colon health. And again, fiber is a variety of different foods. We talk about this a lot in this podcast, but we're not just thinking of the amount of fiber, we're thinking about a diversity of fiber. We're not saying you need a giant salad every day or that you need a grain bowl with all kinds of roasted vegetables and legumes and nuts, especially if your system is sensitive, but even just a diversity of different plant foods. And your plant foods are vegetables, fruit, beans and lentils, whole grains, nuts and seeds. Now, if you would like more guidance on what this actually looks like in real life, I do have a guide for you. So in the show notes, we're going to link to our diverticulitis guide, which outlines more detail on these three phases. So the clear liquid phase, the low fiber phase, and then how to reintroduce. All right. Now, one of the helpful ways to understand, because I've mentioned here that the goal longer term with diverticulosis is to reduce the pressure in the pouches. So let me just talk a little bit more about that as you're thinking ahead toward your maintenance plan. So what do I mean by that? One of the helpful ways to understand diverticular disease is to think about the role of pressure inside your colon over time. So the diverticula, which are the small pouches that form in the colon wall, they're believed to develop when pressure repeatedly builds inside the intestine. And then over time, that pressure can cause weak areas of the colon wall to bulge outward, forming those pouches that are called diverticula. So several factors can contribute to this pressure, and that includes chronic constipation, a low fiber intake, and sluggish gut motility. So when bowel movements are infrequent or difficult to pass, the colon has to work harder to move stool along, and this can increase pressure within the digestive tract, especially in areas of the colon that are already more vulnerable. And this is one of the reasons fiber becomes so important once this is resolved, because it helps things move more easily and reduces that pressure in the colon. Now, what do you do if diverticulitis keeps coming back? For some people, diverticulitis is a one-off event that resolves with treatment and never returns. But in practice, we often see recurrence. So we see a pattern more like someone experiences a flare, they're treated with antibiotics, symptoms improve for a while, and then a few months later, another episode occurs. So I do see this quite often. When this cycle repeats, it can feel incredibly frustrating and confusing, especially if you've been trying to follow the diet recommendations. So when we see this pattern in practice, it often suggests that something deeper in the digestive environment still needs attention. And that would be those three areas. The chronic constipation is often something that needs to be addressed. And that can be difficult to know how to address it. So a lot of people will continue struggling with that. So we need to find a way to fully address the chronic constipation. I'm a big proponent of finding the root cause of these things so that you don't need a lot of symptom just management, but this is one of those areas where we need to keep the bowels moving. So even if that means you're taking something regularly to manage your bowel movements, that's better than not doing so. Ideally, we would figure out what's causing your constipation and resolve that so you don't need a lot of management. But right now, if where you're at is you don't know and you need the Miralax or you need the magnesium oxide or whatever it might be, take it because we need to prevent this chronic constipation. Also, that kind of goes hand in hand with the slow or irregular gut motility. And then there might also be things like imbalances in the gut microbiome that could be contributing to inflammation in the gut lining, or just long-standing dietary patterns that don't support regular bowel movements. And addressing these things can make a really meaningful difference, improving bowel regularity and just supporting a healthier digestive rhythm can all help reduce the pressure and irritation that contribute to those problems over time. And when we work with clients at Nutrition Resolution, this is often where we step back, we look at the bigger digestive picture. So rather than just focusing on the flare itself, we do that. We help stabilize the person, but then we also help you address those underlying patterns that might be contributing to the recurring episodes. So initially, that might be just supporting constipation and regular bowel movements in any way we can, but then we are looking at ideally what is contributing to that so that we can rebuild a more stable, resilient gut and motility over time. This reminds me of another client we worked with. His name was Mark. He came to us after experiencing 3 flares in about 2 years, and each time it looked pretty much the same. He would have a sudden episode of abdominal pain, a course of antibiotics, a few weeks of careful eating, and then eventually things seemed to settle down until the next flare came out of the blue. And when we talked through his history more closely, it became clear that he had been dealing with chronic constipation for years. He often went 2 to 3 days between bowel movements, and his diet had gradually become lower in fiber because he was worried certain foods would aggravate his symptoms. And while he was trying to be careful, that careful food avoidance was actually contributing to the pressure inside his colon and making those diverticular issues worse over time. So instead of focusing on just one flare at a time, we actually worked at stabilizing the bigger picture. We worked with him on improving his bowel regularity so that he could then gradually rebuild in his fiber intake in a way that his system could tolerate. And we helped him to create a more consistent rhythm as well for his digestion overall. As his bowel patterns became more predictable and his diet became more balanced again, his symptoms improved and he felt much more confident about how to support his digestive health moving forward. So, if we zoom out and look at the bigger picture, we want to rebuild a resilient gut after diverticulitis because recovering from diverticulitis does not just mean getting through the flare itself. The bigger objective is helping the digestive system return to a more stable pattern so the colon is not repeatedly exposed to the same stressors that can contribute to future problems. And one important part of that process is gradually rebuilding fiber diversity in the diet. So, as I mentioned a little earlier, rather than just relying on a total fiber goal or maybe just a handful of safe foods, we really want to shift our focus toward reintroducing a wider range of fiber containing foods so the system can tolerate them more comfortably again. And this helps support healthier bowel movements and a more balanced gut microbiome. And that way we can reduce that colonic pressure. The combination over time, gradually expanding fiber intake, keeping things moving more regularly, and creating a healthier digestive rhythm, calming inflammation, supporting microbial diversity. Those are the things that are going to make your gut more resilient. And that actually helps you return to a diet. It goes hand in hand. It helps you return to a diet that's more varied, balanced, and helps you with that fiber tolerance over time. So again, we do have that guide for you if you'd like more guidance. It's in the show note to help look at either what your acute approach is for right now during a flare or what that longer term diverticulosis diet would look like. And sometimes it helps to have support. For many people, diverticulitis improves with time. You might just need short-term diet adjustments, and then you can add in fiber and do fine with it, and you're good. But in some situations, it can be helpful to take a more personalized look at what's happening in your digestive system. So, when might you benefit from additional support? Could be if you're experiencing repeated diverticulitis episodes and just unsure why this keeps happening. Maybe even in between episodes, you're having ongoing digestive symptoms like bloating, constipation, or abdominal discomfort. Or maybe you're having difficulty expanding your diet or tolerating fiber again after recovery. In these cases, it can be helpful to step back and look at the bigger digestive picture. So, factors like bowel patterns, motility, overall fiber intake, and the balance of the gut environment can all play a role in how well the gut stabilizes after a flare. So, if you'd like help with that, you're welcome to schedule a 15-minute strategy call with me, and we can talk through what's been happening with your symptoms, what you've tried so far, and whether working together might make sense for your situation. Either way, if you take one thing away from this, it's this. This way of eating is meant to be temporary and strategic. You are not meant to stay in a low fiber phase long term. You're meant to move through it. The goal is to calm things down first, then gradually rebuild in a way that your body can actually tolerate so your digestion becomes more stable, not more restricted. And when you understand that progression, this whole process becomes a lot less confusing and a lot less stressful to navigate. So if you want something to reference as you're going through this, do download our meal plan guide. And if this is something that keeps happening, or if you feel like you're stuck in that low fiber phase and not sure how to move forward, that's usually a sign we need to look at the bigger picture of what's going on in your gut.